Is radiation synovectomy an effective treatment for RA? Imagine a treatment that targets inflamed joint tissue without the need for surgery. Radiation synovectomy, also called radiosynoverthesis, is a procedure used to help people with rheumatoid arthritis who have persistent joint inflammation that doesn't respond well to standard medicines. It involves injecting a small amount of radioactive material directly into the affected joint. This radioactive substance emits beta particles that penetrate the inflamed synovial tissue, helping to reduce swelling and pain by destroying the excess tissue. This procedure has been used for over 50 years to treat inflammatory joint conditions, including rheumatoid arthritis. It is especially helpful for patients who have not found relief with medications like disease-modifying antirheumatic drugs or biologics. Compared to surgical synovectomy, radiation synovectomy is less invasive. It can be done on an outpatient basis, meaning no hospital stay is usually needed. It also has a good safety profile, with fewer risks than surgery, such as less blood loss and quicker recovery times. Multiple joints can be treated at once, which is helpful for people with widespread joint involvement. However, radiation synovectomy is not without some risks. The most common side effect is a temporary worsening of symptoms called radiosynovitis, which can cause increased pain, swelling, and joint fluid buildup for a few weeks after the procedure. This is part of the process as the inflamed tissue begins to break down. Rare complications include skin burns, ulcerations, or, in very rare cases, tissue damage caused by leakage of the radioactive material. Infection risk is low but should be considered, especially in patients with joint replacements. Patients are advised to avoid strenuous activity for about a month after treatment and, for women of reproductive age, to avoid pregnancy for several months to prevent radiation exposure to the fetus. While radiation synovectomy can be effective in reducing joint inflammation and improving symptoms, it is not suitable for everyone. It works best for joints with persistent synovitis that has not responded to medications. It is generally considered a safe option when performed by experienced specialists, but it does not replace ongoing medical treatment for rheumatoid arthritis. Patients should always discuss with their rheumatologist and nuclear medicine doctor to determine if this treatment fits their specific situation. In summary, radiation synovectomy is a well-established, minimally invasive treatment option that can help manage joint inflammation in rheumatoid arthritis. It offers a less aggressive alternative to surgery with a good safety record when done properly. Still, it is important to understand the potential risks and limitations. Every patient's case is different, so personalized medical advice is essential. This treatment can be a valuable part of a comprehensive approach to managing rheumatoid arthritis, but it should always be used alongside ongoing medical therapies.